Celebration Health went with RTLS in design of the new tower and specifically the innovation unit to really begin to integrate how we communicate and track not only processes within the workflow of ourselves as a care team, but our patients, to monitor what that flow looks like from the patient standpoint, from the time they enter our door to the time that they hopefully leave in a much better condition than when they came.
The initial deployment for RTLS was the temperature monitoring, and we also started with a few assets tracking.
We were very interested in being able to help manage wandering and elopement in a way that was humane, comfortable, not disruptive. And so we were looking at the possibility of using RTLS systems.
The hospital looked to develop an RTLS system, hoping that it would help us locate devices throughout the hospital. We have a very large hospital where many buildings, and we were always struggling looking or locating medical devices when we needed them.
And it was critical that we had a means on a unit that large for the nurses to be able to quickly locate the equipment and technology they needed to care for their patients.
We've done time flow studies with our own staff, and what we found is that, probably a technician spends 90% of their time on what we call non-value added time. And the largest percentage of non-value added time in their workflow is actually going and trying to locate devices.
We did a combination survey of both surveying staff and direct observation of how our clinicians were looking. We came up with the figure of we were spending about $1,700 per shift across our entire facility looking for equipment. That's not just nurses' time, but it's other staff time that's involved as well. $1,700 per shift and 2 shifts per day, annualized, it comes out to over $1.2 million we were expected to be spending on just looking for equipment around our facility.
So some of the solutions we've installed in the innovation unit are we can have the presence and accuracy of staff entering and leaving the patient room, the nurses station areas, etc. throughout the unit, as well as the tracking of pumps throughout the facility so that we can monitor where those resources are that the nursing staff so critically need throughout their care delivery to the patient. As well as the temperature and humidity monitoring within the patient rooms, so that when the patient tells us there is a change in temperature that's maybe too cold, too warm for them, we can identify what the accurate temperature is in that room and adjust it accordingly.
5.5 years ago, we started a very simple process with Aeroscout to simply track assets around the facility. We started out with about 1,200 active tags and tracking equipment. As we started evolving the system to track temperature and track other devices, that quickly jumped up to about 2,500 tags. And as we get more and more requests and demands from our customers, not only to track the high dollar value critical equipment, but to even track some of the more mundane equipment like a patient walker or a cane that's needed to be able to help care for a patient. We're up to about 4,000 tags now active on our system.
Initially, we just tagged 150 devices, and it was very successful. We had over 95% compliance, and we decided at that particular point that maybe we should expand it to other areas of the hospital. So within a matter of a month, we went from about 150 pumps in the system to about 4,000 pumps in the system.
So some benefits that we think have occurred from this. First of all, we think that this has been really helpful, the whole environment, including the resident locator system, in improving the comfort of the individuals there, which has resulted in a lower number of transfers to acute psychiatric care. We also think that this has been very helpful in reducing the number of tailgating elopements. Lastly, we think that it's also helped in the staff oversight of the units. We've got private spaces which are really highly beneficial for the individuals, but it makes oversight more difficult. And so being able to use the locator system is very helpful to our nursing staff on that.
One of the added values of connecting the pumps to the Aeroscout tags was helping us find the pumps during a recall. The hospital is very used to having recall of equipment, but never such a large-scale recall. And not only did we have it once, we had it 3 times in sort of a short period of time, over 6 months, where initially we had to find 1,700 of 4,100 pumps, and the second recall was we had to find all 4,100 pumps again. And I don't think we could have done it as efficiently with the amount of manpower that we utilized to do this without having a locational device on the pumps. It was a true savings of time and effort for the hospital. And then subsequent to that, we had a third recall where we had to find another 1,500 pumps. So we've really been able to see the value of being able to locate our pumps when needed.
So RTLS on the innovation unit and using the Aeroscout technology, we have been able to see improvements in terms of the processes and workflow that we analyze on a daily basis with how the staff function and do their work. So this allows for us to determine how can we better impact your workflow. Are you spending multiple hours of your day searching for equipment? Are you traveling multiple steps on a unit because of your assignments in terms of one patient is assigned to a room in front of the unit and your other patient is assigned to a room in the back of the unit? How are we assigning your workflow? Those are the types of things we're looking for.
The results in the laboratory for the laboratory equipments are saving in hours. So before the implementation, we used to spend 1,200 hours per month, and after the project RTLS project, we spend only 60 hours per month.
We work closely with our patient transportation manager. He often comes up and really tells us and gives us good stories about how his staff use the system. He continually says when they need to find a critical item, like a bariatric wheelchair for a patient, they can look it up in the mobile view system and walk directly to it.
Aeroscout was selected as our RTLS vendor because we truly saw them as a partner that we could use to really build the foundation for the other advancements in technology that we hope to achieve throughout our new tower and innovation unit. They really have become the foundation, the glue that we'll be utilizing in terms of pulling in all the other partner technologies that we have access to really build the type of infrastructure that we want on this unit to truly advance and change the way that healthcare is delivered at Celebration Health.
I think that with the amount of devices and the medical technology that interacts with a patient, we're going to need to develop some sort of system where we put all that information together. And I think that Wi-Fi is probably key to the success of that integration. It's just how it's going to be.
It's been an absolutely great partnership working with Aeroscout. We really truly believe that if you can dream up an idea of a way to use the system, Aeroscout can really help you and develop the means by which to accomplish that.